Hi everyone, we're going to kick off in a minute's time, so thank you so much for waiting, and we will start the webinar very shortly. Okay, good afternoon. Thank you for joining today's webinar titled The Aesthetic Movement. So my name is Daisy James and I am the course advisor for our PGCert in Skin Aging and Aesthetic Medicine. So I guess my role is to really support you in your application, to help guide you through the process and help you make that informed decision as to whether or not the course is the right fit for you and whether you would like to join us in September. So joining me today, I've got Dr. Helen Graham, who is our academic director, and Professor Rachel Watson, who is the unit lead for the unit Skin Rejuvenation. We have two directors of the course. So we've got Dr. Tamara Griffiths, who is the clinical director, who, as you can imagine, is extremely busy at the moment and can't join us. But we have got Dr. Helen Graham, as I mentioned before, as the academic director. Helen and Rachel are going to talk to you about our fantastic online PGCert in skin aging and aesthetic medicine. And they're also going to touch on the developments within the aesthetic world at the moment. Before we start, as you can probably see, myself, Helen and Rachel are all working and presenting this webinar from our living rooms. We are lucky enough to be the ones who can work from home during this time. However, there are some people who can't work from home and are out there on the front line saving lives and keeping the world spinning. So I wanted to take a minute to appreciate all the hard work our medical staff here in the UK and the NHS and around the world are doing during this difficult time. So from all of us here today, from myself, Helen and Rachel, we'd like to say thank you so much. You're doing a fantastic job and we wish you all the best, yourself and your family. So I'd like to talk to you about why Manchester University. So as you can see from this slide, we are a leading research intensive university. 25 Nobel Prize winners worked or studied here, and 83% of our research was ranked internationally excellent. So we really pride ourselves on our world-class academics and who produce world-class content. As you can also see, we are University of the Year for graduate employment, so we're very attractive to graduate employers. In this competitive world, I think coming from a university that is attractive and is seen to be one of the best is very, very important. We're ranked 6th best university in the UK and 27th best university in the world. I'm going to now pass you on to Professor Rachel Watson, who's going to talk to you about why Manchester in kind of a course presence.
So good afternoon, everyone. My name's Rachel Watson. I'm Professor of Cutaneous Science here at the University of Manchester. And I thought what was useful was for me to give you a little bit of history of dermatology at this university. So the clinical academic unit of the Centre for Dermatology Research started in 1994. And what's really important, I think, about what we do is that we take clinical observations, we take them from the coalface, as it were. We look at the importance of that clinical feature, we take it back to the lab, we interrogate it with the long-term aim of being able to improve treatments for patients that you will all be seeing day to day. So because we work in this way and because we are very research focused and hopefully very patient focused, it means that our research is very attractive. And actually, if you look at the amount of impact that the research that comes out of the University of Manchester performs, then we are #1 in the UK. So we are the highest rated dermatology department in the UK. And you can see a little bit about our research there. One of the things which helps us to do this, to be world leading, is the fact that we have an incredibly close relationship with our local NHS trust, which is Salford Royal NHS Foundation Trust. Here we have a tertiary referral centre for dermatology for the northwest of England. We look after the difficult cases in dermatology across the spectrum, not just aesthetics, from eczema, psoriasis, through the photodermatoses, essentially all skin disease. And we cover a population from the north of England, from Lancaster, right the way down to the potteries around Stoke-on-Trent. And I guess this close interaction is really important because it means as scientists we can see the clinical issues people may be facing in the clinic, and it also allows us to take those clinical insights to really interrogate them. So the relationship between the university and Salford Royal, I think, is really fundamental to our success and really important for what we do.
Thanks. So I'm going to talk a little bit about the course directors. So one of our programme directors is Dr. Tamara Griffiths. She's an honorary lecturer in skin ageing and aesthetic medicine at the University of Manchester. She's got a number of affiliations. She's a founding member and past president of the British Cosmetic Dermatology Group, which is a special interest group affiliated with the BAD, British Association of Dermatologists. She represented the UK in the European Standards Group and was key advisor to the review of the cosmetic interventions, which was led by Sir Bruce Keogh in 2013, and we'll talk a bit about that later on in this presentation. Dr. Griffiths also led the subsequent educational frameworks, which mandated to Health Education England Part 1 and 2 papers published in 2016. And she's a founding member and current trustee of a newly formed Cosmetic Practice Standards Authority, CPSA, which is recognised as the professional body responsible for setting standards in this arena. So Dr. Griffiths is also Dermatology Training Programme Director for the North West Deanery, and which is one of the largest dermatology training programmes in the UK. She's also BAD Educational Director, British Association of Dermatology Educational Director. She's BAD representative on Royal College of Surgeons Cosmetic Surgical Interventions Committee and the Healing Foundation's National Institute for Aesthetic Research. She's an advisor to the MRHA, NICE and European Standards Committee, and is trustee to the British Skin Foundation and spokesperson liaising with the national media. So as you can see, she's got quite a huge interest in the aesthetic arena and is instrumental in driving things forward. I'm Dr. Helen Graham. I'm a lecturer in skin ageing and aesthetic medicine. I have a PhD in biochemistry of the extracellular matrix, and I'm a teaching focused academic now with and my research background has taken me through extracellular matrix in development, in heart failure, in the aging heart, which has taken me to the aging skin, which has brought me to the skin aging arena. So I've published over 26 peer-reviewed articles and 3 book chapters in this field. So between us, we cover the clinical and academic side of the programme, but our academic team have been instrumental in helping us develop this programme. So as I've said, we've got Dr. Tamara Griffiths and myself, Helen Graham, Professor Rachel Watson, who's with us here today, who's Professor of Cutaneous Science, who's going to be unit lead on skin rejuvenation and also an academic advisor. And we have Dr. James McConnell, whose background is research, but is also now one of the lecturers on the programme. We also have Dr. Bav Shergill, who's a consultant dermatologist with his own practice in aesthetic medicine. Dr. Sam Hills, who's a specialist in lasers at Linton Lasers. Dr. Mark Farrar, Suzanne Pilkington and Abigail Langton are all active skin ageing researchers and academics at the University of Manchester. So the PGCert in skin ageing and aesthetic medicine has been developed. It was originally developed to address a huge demand for training in the aesthetic medicine sector. and this is currently increasing. So this increase in demand is likely due to continued expansion of the non-surgical cosmetic market, and this is estimated to be worth around 3 billion in the UK, and the global market's predicted to be around 24 billion by 2026. However, despite this huge growth in the sector, the field of minimally invasive medicine is currently unregulated. Practitioners are practicing without accredited training, and there's no system for reporting adverse events. So in 2013, the UK government commissioned an independent review led by Sir Bruce Keogh, and Dr. Griffiths was also instrumental in the response to this. The report highlighted major concerns around the aesthetic arena, and it stated that we're surprised to discover that non-surgical interventions, which can have major and irreversible adverse impacts on health and well-being, are almost entirely unregulated. They also found that dermal fillers are a crisis waiting to happen, and gave a number of recommendations, one of which was to develop the requirements for training, to establish a clear curriculum, and to form a register of practitioners of non-surgical cosmetic interventions. So in response to this report, and in order to address these recommendations, a master's programme in skin ageing and aesthetic medicine was developed by Tamara Griffiths, Meinl Singh and Rachel Watson in 2014. And this master's programme has been running at the university and is now in its 6th year. And it was designed to align with these new Health Education England training frameworks developed by Dr. Griffiths. So this master's programme has been running successfully for 6 years, but has been oversubscribed each year, and so therefore a fully online PGCert in skin ageing and aesthetic medicine has been launched for clinical graduates as an alternative to the part-time 3 years master's programme. So this PGCert programme aims to train clinically qualified graduates to practice safe, evidence-based aesthetic medicine and ultimately improve patient safety and care. I'll hand over to Rachel to describe the structure of the course.
Thanks, Helen. So the structure of the course is essentially 4 CPD units, which you can take either individually or as a collective to produce a PG Cert. So for each of these individual units, we're asking you to commit to 10 weeks of private study. What's really important to note is that there are no on-campus exams, and that assessment is via coursework and via online MCQs. Depending on your flexibility, you can take up to 4 units in any 1 year. Unit 1 is around fundamentals of skin ageing, and this is a prerequisite course, and I can talk a little bit more detail about that in a moment. So once you have the fundamentals of skin ageing in your repertoire, you can then take any of the remaining 3 units in any order. And we would hope that with your work commitments, that within 24 months you would have been able to complete all 4 units, and that these would build to provide you with the PG certificate in aesthetic medicine and skin ageing. Okay, so now I'm going to talk a little bit more around the individual units. And as I said, fundamentals of skin ageing is a prerequisite for this PG Cert. So the idea of providing you with this basic science knowledge is that so you really understand the skin, its physiology and how it changes as we age. So the aim of the unit is to provide you as students with the knowledge of the function and organisation of the tissue in a healthy individual. And there's a great focus on the cells and the extracellular matrix, so understanding how structure informs function. The seminars embedded within this piece of learning are aimed at exploring the mechanisms that lead to skin ageing, and that includes an appreciation of basic photobiology and the long-term consequences of long-term and chronic sun exposure. So really to understand the pathobiology which leads to the clinical manifestations which you observe day to day as practitioners. So as students, you'll be using e-learning to develop fundamental scientific knowledge that will be applied through online discussions, and in various I guess teaching methods to make sure that you have a very enriched environment. And we will want you to develop your skills for critical analysis so that you can understand the current literature. And the unit, as I say, is there as an underpinning foundation for the 3 subsequent more clinical units. So if I can now move on to Unit 2, which is skin rejuvenation. So this unit considers the scientific basis and indications for the latest topical skin rejuvenation techniques, be that the application of topical creams, superficial peels, etc. It's really important here that we use evidence-based practice and that you learn how to evaluate the data around efficacy of treatments. We want you to develop a really good ethical code of practice and be able to provide high quality services to your patients. And there's a theme to the module is about analysis of different skin rejuvenation techniques, looking at your patients holistically and looking at the appropriateness of the treatments for those individuals. And we hope that you'll engage in a variety of different learning techniques, case-based models, which are online, and also small group teaching so that you can learn from your peers. Helen?
Thanks, Rachel. So Unit 3 will cover the injectables in aesthetic medicine. So this module will focus on evidence-based approaches to assessing and formulating appropriate strategies for patients undergoing treatment with these devices. So that would be looking at the toxins, lipolysis and fillers. So as a student, you'd be guided through these techniques and encouraged to utilise your critical thinking skills once again. And we really want you to demonstrate in-depth understanding of the latest research papers and evidence-based practice in this area. And the ultimate aim really is for you to be able to offer high quality patient-centred care. The final unit, which is Unit 4, lasers, will firstly focus on the fundamental theory behind laser devices. And then students will be guided through a range of aesthetic laser techniques and encouraged to critically appraise the research and practice around these devices, both laser and light-based devices used in aesthetic practice. You'll develop again some critical analysis skills through e-learning, discussion forums and expert-led tutorials. So the teaching and learning methods on this program, clearly it's an online only course. So we're encouraging students to engage in the interactive learning technologies. For example, there's a number of recorded video lectures, so you're required to work through those video lectures and take notes yourself and understand all of the content around these. And then after these lectures, we ask you to engage with the formative quizzes just to so that you can monitor your own progress in development of your own knowledge. There's also a number of group-based projects where we split you into small groups of 5 or 6, and you're given some group documents to work on, which will be based around some aesthetic problems or an aesthetic task. And within that, there are discussion activities. So we use discussion boards and discussion forums for you to interact with each other in the design of the and formulation of your group document. You'll also have academic advisor support through group tutorials, and these will be performed in similar to this, a live video tutorial and question and answer session. And there's always recommended and directed reading for you to work through in your own time. And another feature is an online journal club, and we ask you to contribute to this to share good practice, discuss your new research papers, summarise any key findings, and comment on whether you believe that the evidence is clear enough for, to adopt into your own practice. So the entry requirements for this programme are a medical or dental degree, MBCHB, MBBS, BDS, LDS, or an overseas equivalent from an institution that's been recognised and approved by GMC or GDC. So in order for you to secure a place, you will need to have been practicing in your own field following graduation. Okay. So the study requirements, so each of the units counts as 15 credits, which means that this equates to around 15 hours study per week over a period of 40 weeks if you take the PGCert. So what we would ask is to ensure that you're able to attend those video conference tutorials when they take place, that you'll be sent calendar invites for those. And you'll also need a device which enables you to successfully run these video conferencing tutorials.
Brilliant. Thank you so much, Helen and Rachel. That was very insightful. So as I said at the beginning, my name is Daisy James and I am your dedicated course advisor. So please do feel free to contact me with my details below, preferably by email so that I can get back to you as soon as I can. But please do let me know if you need any support in your application and I would be happy to help you. So yeah, thank you so much, Helen and Rachel. We have had a few questions come in, which is great. So I'd just like to read them out and I'll answer the ones that I can and I'll hand you back over to Helen and Rachel for their answers as well. So I've had a question about the cost of the programme. So it's a great question. So the cost of the whole PGCert is £3,900 and each unit is £1,100. As mentioned in this webinar, you must take the prerequisite module first before you kind of can progress onto the others. Another question, I don't want to miss out getting a place on the programme. When should I apply? So I always say it's better to get your application in sooner rather than later. It's a fantastic course and it is very attractive to students. So please do apply as soon as you can. Like I said, I'm on hand to answer any questions you have about the application process. But I would say, due to it being such an attractive programme, get your application in as soon as possible. Another question we have, the course sounds great. I would like to know if there are any practical elements to the course. So I'm going to hand you back over to Helen and Rachel to answer that, please.
Okay, so I'll take that if that's okay. So this is entirely a knowledge-based course. So what we want for you to do, I suspect many of you are already practicing, is to make sure that you have the best understanding of the area in which you're working so that you can provide the best patient care for your patients. So there are no practical elements on this course. It's all about the knowledge and embedding that knowledge in you as practitioners.
Brilliant, thank you, Rachel. And I have one final question. How many years do I need to have been practicing in my field following graduation in order to be eligible to apply?
Shall I take that, Rachel? So we need you to have graduated in medicine or dentistry and been practicing in your field. So usually a minimum would be about a year, but it would be good to discuss with Daisy, the course advisor, if you had any queries specifically around this, because we understand everybody is in a different stage of their career. They might have changed disciplines along the way, so it's always worth to have a discussion with us or Daisy about your application.
Absolutely. Thank you so much, Helen. And thank you both for today's webinar, and thank you to everyone who has joined. My contact details are here. My email address is studyonline@manchester.ac.uk. But thank you so much again for joining. And I hope you can all, if you're here in the UK, enjoy the sunshine this afternoon. But please do take care. And I look forward to hopefully welcoming you soon and definitely speaking to you soon. Thank you, everybody.
Thank you.
Bye.
Bye.
Mm-hmm.